What a packed house. Great to see everybody. Ladies and gentlemen, good morning. Thank you all so very much for coming to South Central this morning to celebrate with us. You know, we're celebrating today, rightfully so, because of the way God has blessed South Central as a health system. Indeed, all glory and honor goes to Him. He's provided for us every step of the way. It's my hope and our prayer that the motivation and the actions that we take are pleasing to Him. My name is Greg Gibbs. About 14 months ago, the board hired me as the CEO, and what a privilege it's been to serve the last 14 months. I'm going to take a moment and thank our board members that are here. We've got a number of elected officials here. Senator Robinson, Juan Barnett, thank y'all very much for being here. Marion, thank you very much for coming this morning. Appreciate you being here. Mayor McGee, appreciate you being here, sir. I know we've got, there may be a few people that I'll leave out, and I'm sorry for that. It's one of the larger rooms that we've assembled in here. The number of partners that I've seen here this morning, I know I've seen Howard Medical here, of course, Jones College being here, William Carey being here. You know, our partners are play a vital role in what we do here. We appreciate that. And of course, I see all our South Central staff, the directors, see our physicians, our medical staff. Thank you for your support. It's a big deal when Mississippi's governor comes to Laurel and Jones County. It's a big deal. Today we're humbled. The Governor Tate Reeves is willing and able to come help us make a number of announcements that we believe will advance health care in our community. We're sure of it. As the 65th governor of Mississippi, Tate Reeves continues to build on his strong record as a leader who fights to improve educational opportunities and grow new careers so that Mississippi's best and brightest raise their families and thrive. Since he took office as governor, Mississippi has seen educational gains which have been called the Mississippi Miracle. Less than 1 month into 24, Mississippi shattered yearly economic development records when Governor Reeves announced $12 billion in private investment. Under your leadership, Mississippi's achieved an overhauled state workforce development strategy, all-time low unemployment rates, the largest tax cut in state history, and the largest teacher pay raise in state history. I'll say, on September 21st last year, I was privileged to stand on the stage with you in the Sillers Building in downtown Jackson. What many of you may not realize, and what some of you don't realize today, the significance of that day. That was the day that Governor Reeves announced a new Mississippi Hospital Access Payment Program that created over $700 million new dollars for Mississippi hospitals. I have often referred to that day as the single greatest day in Mississippi hospital history. Governor, thank you for being here today. Thank you for helping hospitals.
Thank you, Greg, for those kind remarks, and more importantly than even those remarks, I want to thank you for your commitment and your work over many years, working with our team to make Mississippi a better place, certainly from a healthcare standpoint, but just make Mississippi a better place in general. So, Greg, thank you for your leadership, and congratulations on this new gig, and really a huge congratulations on these announcements we're about to make. You know, it's great for me to be back in Laurel today. It's even better when we get to make announcements like we're going to make today. And these announcements will not only strengthen this community, but it's going to strengthen our state's healthcare system. It's going to strengthen our economy. But before I make those, I want to just congratulate the mayor and the city of Laurel. The resurgence of this town has been amazing. It's been inspiring. And it's just, you don't have to go very far to see it. But I'm going to tell you a little story that will tell you that it's amazing to me. I had an event recently at the Governor's Cup baseball game. The Governor's Cup is the Mississippi State versus Ole Miss in Pearl, Mississippi. And I invited some friends from all over the country to come hang out with me and the governor of Oklahoma and watch the game. The governor of Oklahoma and I both threw out the first pitch. Mine was better than his, but don't tell him. But the reason I mention that is because these folks from all over the country came in, and one of them drove in from North Tennessee. And he called me before coming. He said, I'm going to come to your event there at the Governor's Cup. I said, awesome. Do you need me to help you with arrangements or anything? He said, no, my wife's already got all that nailed down. I said, really? Okay. I said, you bring your wife with you. He said, well, she ain't coming to the baseball game. She ain't that big on baseball, but she's coming with me to Mississippi. I said, great. I said, okay. And so we get off the phone. I see him a few days later at the game. I said, well, how was your trip and where are y'all staying? He said, well, the trip's been phenomenal. He said, my wife booked us a place to stay down in Laurel because she had seen what was happening here in this community and she wanted to stay there. And I'm sitting here thinking the whole time, like, I mean, I've been to the baseball park in Pearl a lot of times. I don't know that I would have picked Laurel to stay to come to the baseball game, but had a phenomenal time. They were excited about it, and in fact, literally, he drove up to the baseball game, watched the baseball game, but he spent that night in Laurel, Mississippi, with his wife. So I think it's just a testament to what y'all are doing here in this community, and so I want to thank all of you for your contributions, and Mayor, congratulations. You know, you're doing big things here, and I think we're doing big things in the state of Mississippi. Today, I'm excited to announce a number of strategic initiatives that will not only increase the level of quality and the level of service that South Central Regional Medical Center provides, but will also create additional economic opportunity here in Jones County and in these surrounding communities. During my tenure as governor, it's hard for me to believe, but I'm nearly at the end of year 5. I have been laser focused on building an economy that brings jobs to our state and that brings prosperity to our people. We knew that if we created a business environment that incentivized growth and incentivized capital investments, that our economy would take off. And I'm pleased to say that in many ways, our hard work and our fiscally responsible approach and principles have paid off. The fact is that at just 2.7%, Mississippi currently has the lowest unemployment rate in our state's history. Now, just to put that in perspective, because, you know, a lot of times we forget the past, sometimes for good reason, but a lot of times we forget the past and where we have been historically. When I got elected to state treasurer in 2003, it was pretty consistent that our unemployment rate in Mississippi tended to be about whatever the national average was, plus 150 basis points. Or in other words, our unemployment rate historically has been the national unemployment rate plus 1.5%. We're always just behind where the nation was. Today, our nation's unemployment rate is 4.3%, and Mississippi's is 2.7%. So we have actually improved not only above and beyond where the national average is, but about 150 basis points, or 1.5% better than the national average on our unemployment rate. As Greg mentioned earlier, prior to October of 2022, Mississippi had never announced an economic development project that actually, when all was said and done, exceeded $1 billion in new capital expenditures. And from October of 2022 to January of 2024, we announced not one, not two, but 3 different projects that saw capital investments in excess of $2 billion. All told, over the last 5 years, we've announced almost $22 billion in new capital expenditures in our state, all of which are not only creating thousands and thousands of jobs, but most importantly, creating thousands and thousands of good paying jobs. Those jobs that pay 140%, 150%, 160% of the state average. We now have over 1.2 million people working in our state, more than at any time in our state's history. And with a revamped workforce development strategy, there's more opportunity for more Mississippians than ever before. But a big reason for that is because not only of our small business owners, many of whom are here in this room today, but also because of our education partners, whether it's Jones, William Carey, University of Southern Mississippi, University of Mississippi Medical Center, and everyone in between. But despite all of those historic successes, what I want you to know today is we're not letting up. We're determined to dream bigger, to accomplish more, and continue to make Mississippi an even better place to live, to work, and to raise a family. Now, today, I'm going to make a few announcements, a lot of which is based upon the hard work of many of you in this room. But this is great news for our state. This is a great day to be in Laurel, Mississippi. First, South Central recently received institutional accreditation approval from the Accreditation Council for Graduate Medical Education as an institutional site for residency programs. As a result, South Central is in the final process of seeking approval for an internal medicine residency program, which they anticipate receiving during the first quarter of 2025. Once that happens, South Central will accept their first 10 internal medicine residents next summer. The program is a 3-year program, which means 30 total residents. In addition, we are excited and hopeful that a family medicine residency program will follow in 2026. Now that's what the words on the page say, and let me tell you what it really means to me and the way I think about this, okay? Because I've been working on programs such as this throughout our state for almost 10 years now. I love the University of Mississippi Medical Center, and I love what the services that they provide in our state. I love William Carey, and I love the services that they provide in the DOs that they graduate. But if you look at doctors across America, they tend to locate and practice within 50 miles of where they do their residency. Now, let me distinguish here. Not within 50, now it's over 80%, by the way. Not within 50 miles of where they do their medical education, but within 50 miles of where they do their residency. And so for me, what I have been screaming is we need to do all the residency programs that we're doing in Jackson at the university. In fact, we need to expand that. I'm for expanding it. But what we really need in our state to improve rural health care and to improve access to rural health care and improve access to physicians is more residency programs outside of Jackson. Again, we need more inside of Jackson too, but we need more outside of Jackson in places like South Central. Today's announcement is huge for the future medical community in Laurel, in Jones County, and beyond. It's also another step in keeping more of our physicians Mississippi. Second, South Central recently partnered with Epic to purchase and install a new electronic health record system for this entire health system. It will be the largest financial investment that this health system has ever made. By doing so, South Central will create approximately 60 new jobs with an average pay far in excess of either the community average and far in excess of the state average. They're currently being filled, and I understand that they expect to be fully staffed within the next 90 days. Epic is the #1 patient-centered medical record in the world, and bringing it to Laurel will truly elevate the care for patients. Not only will patients receive their tests faster, but they should also expect to have access to numerous new functions and services that will make their care journey easier. We all know that having medical difficulties is in and of itself a difficult journey. Managing and navigating the system, whatever that is hard for me and my wife and our parents. I know and can only imagine it is equally hard for people who live throughout this community. And anything we can do to make that just a little bit easier is a worthwhile investment. In addition, South Central currently works, as you all know, under a management consortium with Covington County Hospital, McGee General Hospital, and Simpson General Hospital. And just last year, South Central partnered with Covington County Hospital on a project in Smith County. In just a few short months, Smith County Emergency Hospital in Raleigh will open, creating 80 new jobs. In just a few short months, Smith County Emergency Hospital will provide hospital outpatient and emergency care services in a community where they did not exist before, and it would have an estimated annual economic impact of over $17 million a year on the Smith County economy. One of the things that I will tell you is in communities like Laurel, in communities like Smith County, where there are great small business owners, the future is through improved payer mix with better paying jobs through private sector investment and private health insurance. That's the future of rural healthcare. It's where you can bring good paying jobs and people can have private insurance. It is far better for the medical providers because the reimbursement rates are so much better. Finally, I want to provide an update on something that Greg mentioned earlier. We had an announcement in September of last year, almost exactly 1 year ago. But I will tell you that announcement didn't just happen over a 1 or 2 or 3 day decision-making process. It literally took us over or almost a year to get all of the details in place. But I do want to provide a brief update on the Medicaid reimbursement reform plan that was announced a year ago. It's estimated that it will generate more than $700 million in additional funds for Mississippi hospitals all throughout our state. And specifically, I want to just mention how that is impacting South Central. It's an incredible example of how working together we can find solutions for our challenging healthcare environment in America. The MHAP program has enabled South Central to pass along millions of dollars in wage increases to staff over the past 12 months. The new increased funding formula also provided a pathway for the replacement of that outdated equipment and for aging facility infrastructure items. Our healthcare workers, many of whom are in this room, are tasked with saving lives and providing care to those who need it most. Y'all are extraordinary public servants, and you deserve to be generously compensated for the critical work that you do. I'm incredibly proud of the fact that the new MHAP reimbursement plan has allowed this hospital and so many others across the state to put more money into the pockets of our healthcare professionals and to provide for critical investment in state-of-the-art equipment. Mississippi is grateful to every one of you who get up and go to work every day, helping improve the healthcare lives of our fellow Mississippians. We thank you for your role that you play in making Mississippians healthier, make them live longer, and make them and allow them to live more vibrant lives. Now, we also know that many of our challenging healthcare outcomes still exist in our state. We have more work to do in many ways. Some of those are things that can be solved relatively easily. Some of those difficult healthcare outcomes are not solved so easily. But what I will tell you is incumbent upon all of us to continue to educate our fellow Mississippians and recognize that some of those poor outcomes are because of poor decisions that we make individually, and we need to all, myself included, need to do better. And I hope that's something that we will commit to in the future. Throughout my tenure as governor, we have worked tirelessly and relentlessly with many of you and others to improve our healthcare delivery system. Today's announcements are obviously outstanding news for our state and outstanding news for the people of this community and the surrounding communities. However, we must recognize that with every piece of good news, we redouble our efforts to continue to work even harder and to make our healthcare system even better. We remain focused on the future, and we will continue working towards solutions that strengthen our healthcare system all across our state. I want to just take a moment again to thank Greg, the team at South Central, and all of the healthcare professionals across our state. I want to thank our members of the legislature and other elected leaders across Mississippi for the work that they do. The fact is, when working together, we can continue to make lives easier and better and make healthcare more accessible for people across our state. And one thing I can commit to you today is, as long as I'm governor, I'm going to continue to work every day to do exactly that. Thank you all for having me here today. Greg, I'm going to turn it back over to you.
Exciting to feel the warmth of the moment, to feel such a passion for rural health care and a passion to transform healthcare for Mississippi. I truly appreciate the governor, his vision. I appreciate Greg Gibbs for the work he's doing here. That public-private interface is where the answers are going to be. It's where the solutions are. And we're so pleased and blessed to be part of that solution. We want to be part of the solution at Cary. Let me give you a little bit of background about Cary and then just a little bit about what we're doing with South Central. William Cary's College of Osteopathic Medicine was founded in 2010. You know, and at the time, Dr. Tommy King and the Cary Board of Trustees made a bold promise to Mississippi. A promise to graduate doctors that will provide compassionate and high-quality health care to our Mississippi communities. The Cary promise is encapsulated by our mission to graduate physicians who will choose primary care and practice in rural and underserved communities, just like right here in Laurel, Mississippi. also not yet fully realized continues through our Carey's administration and staff, through our students that you'll see, and through our Board of Trustees and our President, Ben Burnett. Since its founding, and we were founded in 2010, what I can tell you is that our goal of creating a physician is to create a servant physician, a physician that's going to lead with their heart. We got too many doctors out there that are incredible scientists. They can analyze numbers, they can look at the latest diagnostic technology, they can take their iPad, but do their eyes look at their patient? Do they hold their patient's hand? Because if we want to transform healthcare, we got to love our brother and sister. We got to hold their hand through difficult times. That's what we're trying to do at Carey. That's what our mission is, and that's where our curriculum is. And for 2 years in a row, recognized by U.S. News and World Report, something, to be honest with you, I never read before I came to Mississippi, to be truthful. Never, paid much attention to it, but recognized by U.S. News and World Report 2 years in a row as #1 in the nation for placing our graduates into rural areas. Top 6 in the nation for placing our graduates into primary care, and 8th in the nation for placing our graduates into underserved areas. I cannot tell you as Dean of the Medical School that was ever an outcome, or ever thoughts that we ever had when we decided to create a medical school. But we try to attract great physicians, physicians that have that compassionate heart. Physicians like Dr. Deepu Thapar and Sam Dabb, like Seth Ladd, Dr. Keith Winstead, some of whom are practicing right here in Laurel right now. We try to attract those students and those physicians. And by doing that, we cultivated a culture of service. And so we're at a different stage now. When we look at South Central, what a beautiful institution it is. And if you look at some of their newer hires, what you're going to see by their name is DO. And when you look to see where they came from, you're going to see they're Carey graduates. And that's the promise. The promise not yet fully realized, but hopeful. Hopeful that in the next decade or so, we're going to see them. And with that, we're forging an even deeper relationship. Because South Central cares about providing high-quality health care to Laurel. It cares about providing high-quality health care to the region. And with that, we are working together to develop a curriculum that's going to envelop my students. In the back, you might see some students wearing white coats. Those are my Carey students. Wave to everybody, if you don't mind. Joy is a dean, because that's the future of healthcare right there. And they're going to be taught by doctors in this room. And they're going to be taught the right way. And so many of these students are going to get that opportunity. And as the governor noted, there's going to be residency programs here. Residency programs, we start with one, and then you expand little by little. And with that, we pray and hope we are the pipeline for those residency programs. And that many of the future graduates that will come from that program will stay here and practice either in this area or throughout the greater Mississippi area. And we think it's going to give more opportunities for those Mississippi rural scholars that are, looking, thinking, what's the future like? Do I want to practice in a rural community? Because as the governor noted, it's hard to practice in rural communities. There's been some great challenges in terms of reimbursement and things of that nature. But we're seeing solutions. Mississippi is a solution state. We're not going to be behind the bus here. We're going to go to the front. We're going to start telling people, these are the directions we need to go. And we're really excited because the belief that Governor Reeves has had with us, the belief that Lieutenant Governor Delbert Hoseman has had in us, and the Mississippi legislature. Forgive me, but I have to say a few names on that legislature list. I need to notice Senator John Pope, Senator David Parker, Juan Barnett, and Representative Missy McGee, who all worked with us to be able to get $20 million in ARPA funding to allow us to build an institute for primary care is we believe very strongly that if we call it out, if we say this is what we're going to do, then we're going to be the best at delivering that. And that's our duty. And by having this great institute, it will serve as a foundation for our relationship with South Central and the future for our growth. It is a singular investment that will have long-term transformational benefit. And it is this foundation that's going to bridge education and innovation, bring our students and faculty together. Many doctors will come down and teach in that institute, and it's all going to benefit our communities. Higher quality care for each and every one of our loved ones, because that's what it's about. It's about transforming healthcare for Mississippi, and transforming healthcare starts here at home, here in Laurel. It's through this mechanism we will succeed together. So I endeavor everybody, let us continue down the path to a healthier and thriving Mississippi, and let us lift each other up, build up one another, and equip each other for success for the future. Thank you so much.
All right, thank you, Dr. Seaver. He can do it. He can do it. Now, I'll tell you, the first night, my first day on the job, I met this man in the parking lot, and he said, "So, what's your plan?" And I said, "Well, you know, I told the board I really want to start a residency program." He says, "Oh, you do?" He says, "Well, I've done that before." I said, "Well, guess what? You're going to do it again." Y'all help me welcome Dr. Tate Reeves Tuesday.
I'll be brief. This is our home. And in our home, if we don't have it, we build it or we grow it. And within the confines of our community, we will do better. We will do the best. And part of our growth here in starting these residency programs, in partnering with William Carey, in our strong associations throughout our community, is that we want to take these jobs, to take these careers, and to start filling them with people from our farmhouses, our gas stations, and our local townships. When we look for the best in our country, we're looking in our own backyard and we're looking in the mirror. I've trained physicians for some time now, and I found that you really only need two things to be incredibly successful as a physician, or to meet my definition of success as a physician. And that's compassion and perseverance. If you have those two things, you have all that you need to become a phenomenal physician. Compassion teaches us that we have to have empathy for our partners. We have to have empathy and the will to do something about it to make other people's lives better. When we look at perseverance, this is a hard job. This is a very hard job. And to be able to have your compassion and help those that need it the most, you have to have perseverance. And that's exactly what we're going to train here today. Through our partnerships, through all the incredible work that Greg has done, our partnerships with Governor Reeves, with William Carey University, Dr. Superow,